Hello, my name is Cindy Czarnik-Neimeyer. I work for Catalpa Health. I'm a therapist and I also am a liaison to the schools. I work with prevention and intervention regarding alcohol, tobacco, and other drug abuse and mental health issues for students. I'm also the mother of 4 and I'm a foster parent. I'm here to talk to you today about the whole concept of building resilience. When we talk about resilience with children, resiliency really is the ability to bounce back. When a person has experienced something, some traumatic or difficult event in their life, what resiliency is the ability to adapt to adversity socially, emotionally, academically, even though there is exposure to difficulty in our lives. When we think about resiliency, if you think about the old toy, I think it was a Fisher-Price toy called Weebles. They were a little egg-shaped toy with a weight in the bottom, and the byline was, "Weebles wobble, but they don't fall down." I think it's a great symbol when we talk about resiliency in children and adults, quite frankly, is that people who are resilient, we wobble, but we don't fall down. And you know what? Sometimes we fall down and then we just wobble right back up again. There was a great study done on the island of Kauai in Hawaii by a woman named Emmy Werner. She looked at about 700 babies, children who had high risk factors in their lives, be it mental health issues, chemical abuse and dependency, maybe there was poverty, those kinds of things, high risk factors in their families. What she noticed as she looked at those families over the long term is about 10%, or about 70 children over the course of their lifetime, even though they grew up in difficult and painful situations, they did pretty well in their lives. They didn't have the concerns academically, socially, economically that we might expect for children born into families with those kind of high needs. So she did some research on those babies, and what she did is she looked at why did they do better? Why did those children bounce back when maybe some other children didn't? The number one factor that she found was relationships. Those children had a relationship with one or more significant adults that helped them to bounce back, that helped them to be resilient in their lives. One of the things that she talked about was those relationships can be family relationships, they can be neighbors, very often they are relationships with a school person, somebody who believes in that child, who has a connection with that child and encourages that child to do well. Other ways that we might build resilience, doing service or doing good deeds for other people, is a sense of humor. Sense of humor really helped them to do well in difficult situations. Also a sense of empathy, standing in another person's shoes and understanding how that person might feel. Also, they had a positive sense of self-worth, that even if they weren't perfect, that they were good enough.